I want to introduce Dr. Wechsler.
Thank you, Scott. Good morning. Good morning. Thank you very much. A little mistake Scott made. I've actually been at CDC 18 years. The last 9 as director of the Division of Adolescent and School Health, and I'm very proud to say that our division has been the federal unit that supported the dissemination of coordinated school health programs, including supporting the wonderful staff you have in OSPI and the State Department of Health, who support all the work being done across the state in coordinated school health. I've made hundreds and hundreds of presentations during my career at CDC, and this is my last one. In 2 weeks, I'm leaving CDC to start a new job as the Chief Executive Officer of the Alliance for a Healthier Generation, which also works to support school health programs. Thank you. And I'm so thrilled that this, along with my partner as the other keynote presenter, Dr. Maxine Hayes at the original summit meeting, I'm so proud and excited to be here in Washington in this beautiful location, giving my last presentation with the Centers for Disease Control. It is so exciting to come back here. You have accomplished so much since I came here in 2007. The health and fitness education standards, the breakfast work, all the schools that now have school health councils, and these amazing examples and all the examples we're going to hear of terrific people at schools making tremendous progress in implementing school health programs. I really feel that we have a revolution brewing here in Washington with school health sweeping the state. But the reality is, you are the pioneers. You are the people who are really starting to get it going. And I think if we did a serious evaluation, we would see that the majority of schools in Washington state still don't get it. They're not there yet. So the primary focus of my talk today is going to be, how do we make it spread? How do we make this, what you're doing that's so exciting, how do we make it the normal way of doing business in schools in the state of Washington? And then the other concern is, if you see the title of my presentation, it has that beautiful word, sustainable. The other big challenge is many times when big changes like this are happening, like what you're doing in your schools happen, many times it's because there is one person who is so into health and who really believes and is very charismatic and is able to sweep other people along, and then guess what? The next year that person leaves for another job in another district and it all falls apart. So the second thing that I'm really going to focus on in my talk is, how do we make it last? So I've got a lot of things to say to you, but we've learned this morning already that in order for you to really hear it, you got to get that blood circulating. So we're going to start off with a little game that I call, That's Me. How many of you have played that game before? All right, here's how you play it. Basically, you're going to be sitting there, and I'm going to make a simple statement in the first person singular. And if that statement applies to you, you rise up off your chair, you throw your hands high up in the air, and you shout out, "That's me!" Okay? This is the way we're going to learn a little bit about each other as well. So let me give you an example. If I was sitting in the audience and the guy on the podium said, "I'm 6 feet tall," that's me! Okay? All right. Let's start with an easy one. I'm male. That's me! This guy's not sure over here. I should know better. Why do I always start with the males? They just don't get it. All right. I'm female. Beautiful. Okay, I am a teacher. I am a physical education teacher. I am a school nurse. I work in child nutrition. I'm in public health. God bless you. I'm a student. I'm a parent of a student. Very good. I was born in the state of Washington. I love the Seattle Seahawks. I knew that Russell Wilson would be that good. That's me. I have no idea who Russell Wilson is. He works right down there. All right. I believe that Seattle will get an NBA team in my lifetime. My district superintendent understands the role that health plays in improving academic achievement. Ooh, we got a lot of work to do there. At least one member of my school board understands the role that health plays in improving academic achievement. Better. One of my state legislators understands the role that health plays in improving academic achievement. Ooh, we got a lot of work to do there. And finally, the most important one, I believe that promoting health should be a fundamental part of the mission of schools. That's me. Very good. Give yourself a round of applause. All right, let me show you now the outline of my talk, and I will begin with a confession. My name is Howell, and I am a data geek. I am from CDC, so there's no way you're going to get around me showing you some statistics. So the first topic I'll talk about is trends in youth health. Then we'll get into some of the challenges we've experienced in recent years, and boy, have we experienced lots of challenges. But I'm going to tell you why, despite those challenges, and despite the massive budget cut that my own division at CDC has experienced, why I remain incredibly optimistic and believe that this revolution will spread in the state of Washington and across the nation. Most of my talk is going to be the third bullet there, strategies for advancing school health. A lot of them are things that can happen at the state level, but you can really take ideas from them and apply them at the district level, the school level, the community level. And last, I'll close with a brief look at, from our analyses at CDC, looking at very successful school health programs, what are the key ingredients? What has made the difference? What are the keys to success? So let's look at some slides now. This is a slide showing trends in the leading causes of death among adolescents, young people ages 10 to 19. This is across the country. And look at that red line going down. That is dramatic progress in the reduction of young people dying from motor vehicle crashes. And why are they not dying so much anymore? Because so many more of them are wearing seat belts, so many more of them are not driving and drinking, so many more of them are not sitting in a car with friends who are driving and drinking, and so many more states have these graduated driver's license laws. This is very powerful to begin with because it shows we can make a difference. We can have an impact. Public health strategies do work when we implement them. You'll see the other two lines, though, we're not really making much progress there. This goes back to 2000, from 2000 to 2010, and we're really not making much progress in reducing the number of young people who are dying from homicide or suicide. And we look at the behavioral data, the percentage of young kids who are getting into fights and carrying weapons, we're not seeing much progress there either. So we have a lot of progress still to be made in reducing violence. The next area is such an important area, and that's related to teen birth rates. The key item there is the line in the middle in green. Look how it's going down, down, down. We had a little blip in 2006 and 2007 where it stopped going down, but since then it has picked up the decline. We are now in our country at the lowest rate of teen births we have ever experienced in our country's history. That does not happen by accident. That happens because a lot of great people like Suzanne Hidde, where's Suzanne? Suzanne, who's your lead at OSPI for HIV prevention and teen pregnancy prevention, are doing amazing work because so many of you are teaching kids in the classroom about why it's best not to get pregnant as a teenager, and because so many of you are making them feel valued, that they have an important life ahead of them. Those are the reasons why the teen birth rate has gone down so dramatically. It's not because, the bottom line there is the abortion rate. That's also going down. It's not because more kids are having abortions. It's because fewer kids are getting pregnant in the first place. It's still way too high, by the way. We still have a teen birth rate that's several times higher than most countries in Europe and Japan and New Zealand and Australia and all the other high-income countries. So it's still, we're still embarrassed and humiliated at our incredibly high teen birth rate, but it's going in the right direction, and that is something to celebrate. However, we see that while we made good progress in the 1990s in reducing the percentage of high school students who were having sex and increasing the percentage of those students who were having sex who use condoms, despite that, since about 2000, we've stopped making progress in that. So we have a lot of room for improvement in reducing sexual risk behaviors, and we're seeing the consequences. We are not seeing reductions in sexually transmitted diseases among young people, and I'm very, very sorry to tell you this, but young people are the only age group where the HIV infection rate is actually going up. So we have a lot of work still to do in sex education and addressing sexual risk behaviors among young people. Here's some data on substance use, another great success story. You can see the top line that's going down there is alcohol use. And in the past 10 years or so, we've seen dramatic improvements. Again, the rates are still way too high, but the percentage of high school students who are using alcohol has gone down dramatically in the past 10 years. You can see the bottom line is cocaine use. That's kind of held steady. Tobacco use went down for about 10 years. Now it's kind of sitting still there. So we need to reinvigorate our efforts on getting our young people not to start smoking. And the line that's going up in green in the middle there is marijuana use. Marijuana use, in our last survey in 2011 for the first time, there were more high school students using marijuana than smoking cigarettes. And I think that's been the case in the state of Washington. Who knows what's going to happen in that regard in the state of Washington, but it's something to keep our attention focused on. And then there's the biggie of childhood obesity. Look at that increase from the 1980s. From 1980, that's when the lines start going up and up. The red line is elementary school age students. The green line is secondary school students. You can see it's going lockstep together for both of them. The rates just skyrocketed from 1980 on. But since about the year 2000, 2002, you see how that line, which was going like this, is kind of, it's starting to slow down. We may be at the start of turning the corner. That doesn't happen by accident. All those people who stood up and said they were PE teachers, all those people who stood up and said they were child nutrition directors, this is a result of what you're doing in the nation's schools. We are starting to slow down the rate of growth in child obesity. We may be turning the corner. We do know that in some of the states and cities where they have put in the most resources, where they've made the greatest efforts to reduce child obesity, their rates are now starting to go down. So even in this area where the news has been so bleak for so long, our efforts do pay off. We can make progress. We are making progress. We've just got to do it a lot quicker, a lot stronger, and we can see a brighter day for our kids. So with that as sort of setting the stage, let's look now at some of the challenges and opportunities for school health that I've seen in my 18 years working on school health programs across the nation. Many, many challenges. I'm going to highlight what I think of as the four big ones, the four horsemen of the apocalypse, so to speak. Number one, the budget cuts. You have experienced that here and in all the states across the country, and we are truly experiencing that at the federal level. Last year, our budget at the Division of Adolescent and School Health was reduced by 25%, an unheard of cut, and it wasn't because we're not doing great work. And so our ability to support people like Suzanne, who do HIV prevention for schools in the state of Washington, is very much in jeopardy. So this is very scary and very challenging. A lot of the work that's been done to pull all of you together and to support the work you're doing comes from federal grants, and those dollars are being severely cut at this time. We've lost infrastructure. There are fewer people, professionals available at the federal level to help their colleagues at the state level. There are fewer colleagues at the state level to help people at the local level, and that takes a toll. That is going to hurt our progress in improving school health. The biggest challenge of all, I think, are the pressures for accountability. Education has become such a politicized field, and everyone wants, all the politicians want to see results. They want to see that you're making progress, and so that's why we have this mania, this obsession with standardized test scores. And about 5 years ago, the tide started turning, and everyone realized this is nuts, and everyone started making fun of No Child Left Behind and coming up with funny names to joke about it. And people now see the light that we can't be so totally obsessed with test scores. But guess what? That hasn't really changed. People understand that it's wrong now, but we're still doing it. And it's making it very, very challenging to institute and to maintain school health programs. And then the last one is really perhaps the biggest fundamental structural challenge to school health programs. I call it the aging population. How many of you, raise your hand if you're a baby boomer? Yeah, it's your fault. It's our fault. okay? I think this is one of the biggest challenges we face because so many of the people who there's such a big age group there and the baby boomers, and we're reaching the age, my youngest child is 20. She's going to next year, her last year of college, and there's so many of my fellow baby boomers in such a position that, guess what, we don't have kids in school anymore. And we all tend to get selfish. And we all think, well, why should I support any tax increases to pay for schools, you know? I mean, I don't have any kids in school. And that is going to be one of the most fundamental challenges. We need to convince all of these baby boomers that they still have to support school systems because that is our nation's future. Whew, have I depressed you yet? These are very, very fundamental, profound challenges to us getting to expand and implement the kinds of programs you've heard about and will hear about in the afternoon into more and more schools across Washington and across the nation. But fear not, there is a lot of amazingly positive things out there that convince me that school health does have a bright future in this state and in this nation. I'm going to highlight 4 of them. One, we have some amazing new, relatively new federal initiatives that are bringing lots of resources into states and communities. We have amazingly energetic and terrific NGOs, that stands for non-governmental organizations, that when I started in this work 18 years ago, even 15 years ago, 10 years ago, didn't exist, but have come together to deal with the health problems that our young people face. We are starting to feel the love from the private sector like never before. I have been forever in this field of school health. I've never seen a time when we've received so much support and even better resources from foundations and corporations, and I'll share a few highlights of that. And then, who do you call when you're in real trouble? Bring in the Marines. We are starting to see great support for school health programs from the United States military. And one thing the United States Congress has a tough time doing is saying no to generals and admirals. This may be the most exciting development of all that makes me feel very optimistic. I'm going to give you some examples of all this. Federal initiatives. Who's heard of Let's Move? Yeah? Nothing has raised consciousness about the importance of dealing with obesity in children and the importance of building strong school health programs like this campaign led by a wonderful First Lady. So Mrs. Obama's campaign has really done a lot to raise awareness, but it's also mobilized. She has put the heat on a lot of organizations, a lot of foundations, a lot of corporations to change their practices, to invest resources, and that is making a huge difference. She's supported some of the leading government programs like the USDA's Healthier U.S. Schools program. They launched a few months ago Let's Move Active Schools, which is a great opportunity for schools to improve their physical activity and physical education programs. And her efforts have really helped lead to profound policy changes as well, and nothing bigger than the Healthy, Hunger-Free Kids Act of 2010. Look at all the amazing changes that are being put in place as a result of this. And yes, there's never a good time for major changes being implemented. And yes, it is challenging, and there are some people who have felt some aspects of this that have been controversial. But this is really profound change that's going to make a difference for kids all across the country. My agency, the Centers for Disease Control and Prevention, has launched a couple of different initiatives. First, it was called Communities Putting Prevention to Work, that put many millions of dollars into the state of Washington to improve public health with a big focus on nutrition, physical activity, and tobacco use prevention, with a huge focus on supporting school-based efforts. And this is its successor, the program that's in existence now, Community Transformation Grants. Maxine, maybe you can correct me, but by my count, I think there's been more than $8 million a year put into the state of Washington to support physical activity, nutrition, tobacco use prevention, the promotion of preventative services like blood pressure and cholesterol screening. Yeah, it's been terrific, and not every state gets that much because you have really, really smart people at the State Department of Health, and they've been able to write great proposals to bring these dollars in, and much of that work is happening in the schools. So when you receive support from the State Department of Health, a lot of it comes from us at the Centers for Disease Control and Prevention. You're all familiar with the Presidential Youth Fitness Program? It used to be called the President's Challenge. And then we also had this thing called Fitnessgram. That was another way to measure physical fitness in schools. And it was really hard because the President's Challenge was really famous, and Fitnessgram was really good, and the President's Challenge wasn't really good. And we couldn't say that, but now we can say that because they threw out the old President's Challenge, and they basically adopted Fitnessgram as the one approach to measuring fitness among young people. And it's terrific. We now have a logical world in physical activity measurement, and this is leading to terrific progress across the country. About 6 or 7 years ago, Congress created the Office of Adolescent Health, and they decided that the resources for teen pregnancy prevention ought to be put into science-based, evidence-based, strong, effective programs, and they've been disseminating about $100 million a year to communities across the country to implement evidence-based teen pregnancy prevention programs. That's something to celebrate. That gives me a lot of optimism. I can go on and on with government agencies, but let me share with you some of the NGOs, the non-governmental organizations that are doing amazing work. Well, let's start with this one here. How about Action for Healthy Kids? I was there at the inception in 2002 when the Dairy Council and Surgeon General Dr. David Satcher launched this organization. What a great group. It brings people together to pool their resources and figure out what's best for their states and communities. Created lots of wonderful resources, coalitions in every state, and is really making change happen. So this, again, when I was going across the country telling people there's a child obesity epidemic coming and you ought to pay attention, and nobody was paying attention, we didn't have groups like this. This makes me excited and very optimistic. I'm kind of proud of this group too, the Alliance for a Healthier Generation, which is probably reaching out and working with more schools. They've been working with over 17,000 schools across the country to get them to implement systematic change so that the environments within the schools make it easy for young people to be physically active and make healthy eating choices. So great things are happening out of the Alliance for a Healthier Generation. Some others you may or may not be aware of. This is a group called School Food Focus. Try to say that fast 20 times. Brilliant idea. They're focusing on a very, not a particularly sexy topic, but they're making profound change. They're focusing on the issue of food procurement. They are getting large school districts across the country to come together and pool their resources so that when they place orders for food, they can get the healthy stuff, the fruits and vegetables, the whole grain products. They can get those things at much lower price. What a brilliant solution. This is funded by the Kellogg Foundation and is making a profound difference in what kids and school systems get to eat all across the country. This is a group called the Center for School Health and Education, and they are the leading advocacy group supporting the increase in school-based health centers. We are in the process of expanding considerably the number of school-based health centers across the country. And again, this group is supported by the Kellogg Foundation, one of many foundations that are seeing the light and realizing that they need to support school health programs. So let's look at some of the private sector support for school health programs. This is a partial list of some of the supporters for Action for Healthy Kids: the Dairy Council, Kellogg's, the National Football League, Walmart, are all contributing to support the work of Action for Healthy Kids. The Alliance for a Healthier Generation is supported by the biggest funder in the health promotion field, the Robert Wood Johnson Foundation, the Dell Foundation from the computer company. They're involved in this, Sanofi Aventis, Walmart again, and Kaiser Permanente, a big healthcare provider, is supporting the Alliance. There are so many groups now. Now, we still have people and good work that is not able to continue because of lack of resources, but I can tell you from my long career in this field, we have never, ever come close to having this many private organizations, foundations, and corporations see the light and understand how powerful promoting school health programs can be. And really, it's in their self-interest, particularly for the corporations. This is a survey that was done of 400 of the largest corporate employers in the country. They asked them, what's the #1 factor that's having the greatest impact on the workplace in the next 5 years? Overwhelmingly, there was one choice, and that choice was rising healthcare costs. Our corporations are being strangled by rising healthcare costs. We cannot compete in the world economy until we get those healthcare costs under control. And then they asked them about what do you want schools to do in terms of the workforce that they are preparing for you corporations. They said, well, we know that you want them to teach basic literacy and numeracy so they can count. That's real important. But of all the other things that schools should teach, what's the biggest, most important thing that you, the corporate leaders of America, what do you think schools should be teaching? Again, by far, there was one answer that rose high above all the others. The number one answer was concerning health and wellness education. Health and wellness education was by far the number one choice of corporate leaders for what schools ought to do beyond the basics of literacy and numeracy. So they understand it, and the numbers are just overwhelming. They see how our country is being devastated by these billions and billions of dollars in healthcare costs from the health challenges that our young people face. Now, this is very exciting to see the corporate and foundation support, but to me the most exciting thing is the military support. Do you know how we got the National School Lunch Program in this country? Started in 1946, and the key organization that led to the creation of the National School Lunch Program was the United States Armed Forces. You know why? Because in 1946, little history lesson, we just come out of World War II. And in that war, the military found they had to reject thousands upon thousands of young people who they wanted to serve as soldiers. They were not able to serve as soldiers because they were malnourished. And Congress said, you know, those Russians are a big problem for us. We may have another war. We cannot have that kind of situation again. Congress, you got to do something about this. We cannot have all these malnourished kids in this country. That led, because Congress does not like to say no to generals and admirals, that led to the National School Lunch Program. Well, now we're at a stage where the problem is not malnourishment or undernourishment, but it's overconsumption, lack of physical activity, and obesity, and the military is starting to understand and rally behind. This is a wonderful organization. Raise your hand if you've heard of a group called Mission Readiness. Good. You should, because they are one of the greatest assets and resources we have. This is an organization comprised of the top brass. There are over 300 retired generals. They have to be retired because they can't get involved in these kinds of issues when they're in active service. But over 300 retired generals and admirals, lieutenants, captains, majors, need not apply. Okay, it's only generals or admirals. Several of the members of this group, you would recognize them because you've seen them on Meet the Press. They had this little job called Chairman of the Joint Chiefs of Staff. The top brass in the military are in this organization. And the mission of Mission Readiness is to call for smart investments in our children. And what do they see? What are the top priorities for this group, the retired generals and admirals? 3 top priorities: expanding high-quality early childhood education programs. 2, increasing access to healthier food at school. 3, improving the quality and quantity of physical education. These are the generals and admirals that Congress just can't say no to. And in fact, they couldn't say no to this group. In 2010, this group came out with a terrific report, well-documented, a brilliant scientific report that pulled together all the evidence and explained why these needs were so important, and it focused on the second one, increasing access to healthier food in school. They came out a report that they entitled brilliantly, "Too Fat to Fight." Boy, did that grab Congress's attention. I'm not sure that they would have passed that Healthy, Hunger-Free Kids Act if that report hadn't come out. Well, last year, this group said, you know, it's great that we passed that act, but there's still so much progress that needs to be done, particularly around physical education. So they came out with another report, the sequel. Guess what it was called? Still Too Fat to Fight. Here are just some quotes. I'm giving you these quotes. Use them. Find a retired military officer in your community, show them this stuff, get them to speak at the school board. But here's what this set of retired generals and admirals wrote. The problem of junk food sold in schools is not just a national health issue. It is a national security issue. And that goes for all the different health issues that you're dealing with. About 1 in 4 young American adults is now too overweight to join the military. We cannot succeed in teaching our children to eat healthier foods while selling them 400 billion junk food calories in our schools every year. Great stuff. Great quotes, great data. You've got to use this. Because you all know, you run into school board members, they have particular political inclinations. They just don't want to hear what you're selling. Bring in a retired military official, share this information with them. We might actually get somewhere and make a difference. So, despite the terrible budget cuts we've experienced, despite the continuing national mania for standardized testing, I still feel optimistic. I still think there are exciting government initiatives being launched. There are amazing non-governmental organizations out there helping us. Foundations, corporations, the military, they are coming to see how important the work you do really is. So I remain optimistic. I think this revolution is really going to spread and it's going to stick. But we need to be smart, because it doesn't happen naturally. We have to fight for this. And so that brings me to the central part of my talk, strategies for advancing school health. Now, there are two types of strategies. There's a very narrow, particularly focused type of strategy, which talks about specific school policies in particular areas. So obviously we have to pass requirements for health education, physical education, recess, physical activity breaks, out-of-school time programs. We need to have requirements for professional qualifications of school staff, for PE teachers and child nutrition directors, and high-quality professional development. We need nutrition standards that are strong for school meals and competitive foods. We need to work on food procurement and advancing farm-to-school activities, increased access to school breakfast, which state of Washington is a national leader and a role model for other states. Even outside of the obesity area, we need support for school employee wellness programs. We need to have a full-time nurse in every school. Go to our website. We have a data collection system called School Health Profiles, where we collect data on school health programs across the nation. And we have these maps that are color-coded, and you can see the darker the color on the map, the more schools in your state are doing the right thing. When it gets to the percentage of schools that have a school nurse, sorry to tell you, but Washington is the fairest of all colors. Washington is far behind advanced states like Mississippi and Tennessee and Alabama, where they actually do have nurses in most of the schools. So you have a lot of progress to make on that particular specific policy. Requiring asthma action plans, require a screening and follow-up for vision and hearing, like Dr. Bash was saying. All of these are really, really important things. But I want to talk to you about not these specific policies, but what I consider the foundational policies that build the capacity of schools to do all these kinds of things, to get these kinds of policies implemented, to get them implemented well, and to make it stick, to make it sustainable, to make sure that schools have an organizational structure, a management approach, so that they can institutionalize and keep school health activities and policies going. And really make it work. Obviously, the model that we like to promote is coordinated school health. You all probably know about the 8 different components and how we have to really make sure we're doing state-of-the-art work in each of those components. But it's that red circle. It's the coming together of each of those components that really matters. And how do you do that? You do that through you always have to have administrative support. If you don't have assistant principals like this guy over here, you're just not getting anywhere. And this guy is the key, I imagine, to the incredible success that they've had in their schools. You need to have a school health council to make it last, so it doesn't depend on just Bunny and one person in a particular school or district, that there is a groundswell of support for it. But you do need to have a coordinator. You need someone who's in charge, who's the go-to person, and speaks to the school board and superintendent about it. You need to do assessment and the kind of strategic planning that Dr. Bash was talking about. And we at CDC have created a while ago a tool called the School Health Index that helps you do that. How many of you have used the School Health Index? Very nice, very nice. And then that enables you to implement multiple coordinated evidence-based programs of the kind that Dr. Bash was talking about. So all these things in place are what's really going to make the difference. But how do we get there? You've had visionary leadership in your schools and districts. That's why you're here today. How do we make this spread to all schools across the state of Washington, and how do we make it last so people don't get burned out, so it doesn't fall apart when your visionary leader moves on to another job? With apologies to David Lenneman, I'm going to offer you my own top 10 list. The top 10 strategies for advancing school health. Now, these are not going to be about the specific things like physical education or competitive foods. This is going to be about the base, the foundation that makes it possible for you to do all those things and keep them going. So I would like to propose 3 different areas that we can really work on to advance school health. 1 is marketing. 2 is building capacity, and 3 is integrating into the mission. And for each of the ideas I'm going to suggest, I'm going to give you an example of where it's happening across somewhere, either a state or a city, where it's happening across the nation. And you can call those people up and find out about it. 5 years from now, I'll come back to the next summit, and hopefully I'll have Washington examples all across this list. So let's start with marketing. The first thing we can do is make it easier for people. We need to develop tools, things that, we're passionate. We're the crusaders, the missionaries who really believe in school health. We got to get all those people who, that sounds like a good idea, but I got other problems. I got other things to do. We got to make it easier for them to implement the great ideas that we have on school health. Well, CDC's been doing this for some time. There are guidelines for school programs on promoting physical activity and nutrition, school health index, the curriculum analysis tools for health education and physical education. USDA has lots of tools. My goodness, 10 years ago, we didn't have so much. You're really lucky to be doing this now. There are so many amazing resources. Action for Healthy Kids, the Alliance have come up with great resources. NASPE has so many physical education resources. There's so much out there. And let me just give some kudos to OSPI, because how many of you have gone to the website and looked at this stuff? There are not many states across the nation that give schools this kind of technical assistance and support, where you can go to a website and just download, without going to a training even, you just pull up these great videos, and Lisa's really made for TV, isn't she? She's terrific. She's terrific in those videos. You've got to share this with people. It seems like most people here are familiar with these. Spread the word. All your colleagues in other schools, they've got to know that these resources exist, so that it makes it so much easier to implement the Washington health and education and fitness education standards. The tutorials, the assessments, my goodness, you can pull down all these assessments that have already been made for you. Terrific kind This is going to help make a difference and make it last. All right, strategy number 2, under marketing. Well, Dr. Bash really kind of wrote the book on this. We need to show people that health is academic. That just has to be accepted totally by everyone. There's some things that just make my skin crawl, and I get really angry. What really makes my skin crawl is when some well-intentioned person who believes in our cause gets up and says, well, it's important for schools to teach about health, and along with all the other academic subjects. You got to stop people from saying that. We've got to control the vocabulary. You cannot say health and the academic subjects. You need to say health and the other academic subjects. Look up the word academic. There's a wonderful document that NASPE, the National Association for Sport and Physical Education, did that explained why physical education is an academic subject. It listed out what the dictionary says is the definition of the word academic, and it said bingo, bingo, bingo. Physical education is an academic subject. Health education is an academic subject. Don't let anyone segregate us and put us aside and say, well, yeah, math and language arts, yeah, those are the academic. No! Health education and physical education are academic subjects. So let your skin crawl if anyone tries to get away with that, and speak up, talk to them. You are so lucky to be working now rather than when I started in this field long ago, because you have so many resources now that can show people that health is academic. There's so many more studies. This is Dr. Bash's amazing report, which has been used in countless, every PowerPoint presentation across the country is using his stuff, and you ought to too, because it's brilliantly done. I know a lot of the research. I reviewed this. It is a brilliant piece of scientific work, and it makes the case very, very powerfully. CDC 2 years ago came up 3 3 years ago, came up with a report that all you physical education teachers ought to be using. It summarizes the links between school physical activity programs, including PE, that they have on academic achievement, makes a very powerful case. And on the right is the beautiful contribution, the Dilley report that the state of Washington came out with in 2009. That is one of the best documents around. You have all the resources there. Now you have to shove it in the faces of the school board members. You need to say it over and over. People don't learn something the first time you tell them, by the way. Don't get discouraged. You got to say, just like kids, you put the broccoli in front of them, nah. You put it again, you put it again and again and again, eventually they are going to eat that broccoli. That's the way it works. You need to do that with school board members are just like children. You got to put this information in front of them over and over and over again that health is academic. Strategy number 3, public recognition. Everybody craves. I love this speech by Reverend Dr. Martin Luther King where he talks about being a drum major for justice. And he says how everybody, the number one thing that motivates people crave recognition. We have got some of the most successful state programs I've seen and national programs is when they recognize the schools that are making a difference. And they make all the other schools jealous. You've got to do that in your, at the state level, you may do that for your schools by giving awards and publicly recognizing schools that are making a difference. At the district level, you can do it for your schools. Within your school, whoever has made it possible for your school to embrace health as a fundamental part of the mission of the school, give them an award. Make up something. Create an award in their honor. Do something to recognize them. So a lot of organizations now are giving awards to schools, and it's really cool. They have them come up and they give them a plaque or something, and they shake their hands, and maybe they send the photo to the local newspaper, which I would recommend you do. But the organization I'm joining, the Alliance for a Healthier Generation, they do it in a real cool way because they honor a couple hundred schools every year that are making a difference in school physical activity and healthy eating and have gone through a rigorous evaluation process to prove that they really are making a difference. And they bring them up and they give them a plaque. But it's really cool when that plaque and certificate is given to them by the 42nd President of the United States. That people really get a kick out of that. The Clinton Foundation was one of the founders of the Alliance for a Healthier Generation, and Bill Clinton every year goes to an event where he honors each of these amazing people who are making a difference in schools. So whatever it takes, find the Bill Clinton in your community and make sure that the people that are making a difference get recognized. All right, let's now move to building capacity. Dr. Bash mentioned this, there's no better way to build capacity than to pay school districts to have school health coordinators, and the state of Tennessee has done that. Basically, in Tennessee, they have health coordinators in every single school district funded by $15 million appropriation from the state legislature. It's a lot of money for a small, poor state, but they've proven that it works. It's leading to improvements in the obesity rates, in the graduation rates, and that is something that every other state can aspire to. Strategy number 5, pre-service education. As Dr. Bash alluded to, we don't do a good job of educating our teachers, our nutritionists, our administrators about what they should be doing in terms of school health. CDC does a great project with the American Cancer Society where we bring together faculty in institutions of higher education. The people who train the next generation of health educators are brought together and we help improve their skill level so that they can do a better job. As Dr. Bash said, we've got to involve the colleges of education. Strategy number 6 is school health leadership academies. This is a really intensive form of giving technical assistance. It's a state entity adopting several school districts and giving them over a multi-year period intensive technical assistance on how to implement coordinated school health. They did this in Michiana. That's not a state. It was a combined effort by the states of Michigan and Indiana, and they had terrific results that I can't go into because I'm running out of time. Strategy number 7, well, this is a great way to build capacity. Wouldn't we be able to do so much more at school if we just had a little more time with the kids? Well, I never included that in my list because that's science fiction. Taxpayers are not going to go for an expansion of the school day, but guess what? They did it in Chicago. They added about 45 minutes to the school day in Chicago, and here's the best part. They insisted, they required that some of that extra time be spent on recess. So there is some hope that that's something that we can reach in other communities and states. And now the most powerful of all the strategies, integrating into the mission of schools. Number 8, require school health processes. Well, we all know about the wellness policies, but you can do a lot more at the state level. And one example is the state of Connecticut. They passed a very nice beverage policy that limited the high sugar beverages, the low nutritional value beverages in schools, but then they backed it up. They said every school district has to send to their State Department of Education, we have to look at your wellness policies. We can't tell you what to do, but we're going to grade you. We're going to assess them, and we're going to put our assessment up online for everyone to see. That's powerful. And then they said, by the way, if you're meeting all of our standards and criteria for healthier school food, guess what? You're going to get reimbursed an extra 5 cents for every meal that you serve. That's a lot of money coming into schools. That's putting a powerful incentive. That's changing the way schools do business. That's the kind of change that can really sustain school health programs. Then there are some of the wonderful things that are happening in some school districts, but we need to happen in more, and it's actually being required. You can see the abbreviations or the names of the states that are doing each of those things, but there are quite a few states that require every school district to have a school health council. There are a couple of states that require a school health coordinator in every district, and there are a couple of states that require schools, all the schools, to use CDC's school health index. That's happening. It's happening in other states. It can happen in Washington. Number 9, include, as Dr. Bash suggested, include health goals, targets as part of what is required in the school improvement plans. This is not science fiction. There's a list of 5 states. You'll be able to pull down these slides and look at it more closely. But we have at least 5 states. I think we're up to 7 states now that actually require schools to include health data or health goals in their school improvement planning process. It can be done here as well. And finally, number 10, I think this is the biggest payoff of all, and that is incorporating health into the metrics by which schools are judged. And a prime example of that is in Chicago, where they have a report card for schools. Do you have report cards for your schools that get posted online? Yeah. Most states do. Well, they have them in Chicago, and they list things like, the percentage of kids that are reading on grade level, the dropout rate, and things like that. In Chicago, they added, did they pass the Healthier U.S. Schools Challenge? Are they meeting the nutrition criteria set forth by the U.S. Department of Agriculture? There's only like 5 things listed there. Health is one of them. That's how you grab the attention of principals. That's how you spread school health across a state and a nation. That's how you make it last. So there's the list of my top 10. You can study this more. I'll be glad to take questions about it. These are the foundational strategies that are really needed to make a difference. But what makes a difference in each individual school level? That's what I'm going to close with. The keys to success. In my career at CDC, we've put together 2 books. Making It Happen was about schools that have done great things in nutrition, and Active Youth was about schools that have done great things in physical activity. And we looked at all these amazing examples of success, that schools that really made a difference in promoting healthy eating and physical activity. And we looked across and said, what do they have in common? What were the common ingredients? Because from that we could identify, this is what makes a difference in schools. So I'm going to share with you the most common things that we found that were really the keys to success. First of all, they found that the laws and regulations passed by states and districts and the federal government really makes a difference. Because once those laws and regulations get passed, many schools use them. Advocates within schools use them to start promoting improved policies and practices. Reference materials, things like the School Health Index and Lisa's videos on the website. Many of those schools pointed to things like that and said, that's what turned the corner for us. That's what made the difference. And of course, you have so many more of those materials now than we've ever had before. A lot of it comes down to the process that you follow in trying to get people to adopt good school health policies and practices. So where we saw success was where there was a lot of collaboration, a true team approach. It wasn't one heroic person doing it all, but responsibilities were shared, and they really worked together. Students and families were involved in example after example. You've got to incorporate that in your work too. And the people leading these efforts really paid attention to the process. They had intensive follow-up. They didn't let things fall by the wayside. They knew that the process mattered, and they had to do it in a positive, competent way. Really, personal attitudes mattered as well as the approach taking. So when most of the successes, they used some kind of marketing techniques, not $100 million advertising campaigns on TV, but they really thought about how can we educate and persuade young people to make healthier choices, and how do we persuade teachers to adopt new practices? And they tried to put themselves in the minds of teachers and children. That kind of approach repeatedly showed success. They had a customer focus, and having a positive, you could see it in the examples of the people who came up here to talk, and you're going to see it in the next examples. Success comes from having a positive attitude and great enthusiasm. Data is key. A lot of groups found that until they could show some numbers, whether it was national, state, or information they collected just from their own student body, putting that in front of the school board and in front of the superintendent, that made a difference. And a lot of times with the successes, we saw that they had to do the work before they got the resources. In order to get the resources, they had to show that they had a quality program. So sometimes you just got to stick your neck out there and say, I'm struggling now, it's a lot of time, but once I show value, once I show that we have a quality program here, it's going to make the difference and the support is going to come. And these are key characteristics of success, but by far, over and over and over again, in all these stories of success, we saw that there was one ingredient, that there was one single, most consistent and important key to success. And that key to success is what we, in our scientific behavioral science way, called the local change agent. What does that mean? Who is the local change agent? The local change agent is the individual who says that the status quo is not acceptable, who says that our kids deserve better. It's the individual who has the energy, the persistence, the commitment, the passion to make change happen. It's the individual who has the patience to involve others, to coordinate complex processes, who puts in crazy long hours but never gives up. No matter what obstacles get put in their way, this individual never gives up, because this individual knows he or she is fighting for our kids. So who is the local change agent? It's you. You are the key to making change happen. I salute all of you for all that you're giving to make this a better world for our children. Please keep on doing what you're doing, and let's get it spread all across the state of Washington. Thank you so much.
I work in the whole county school districts, and we have the majority of our schools are changed to where you can't have sugary drinks on campus. The problem is right as you walk out the door, and there is the vending machines, because the soda industries are financially contributing to some of the sports programs, and we cannot get our school board to change and get rid of the pop at the football games, basketball games, and et cetera. So, any ideas?
Yes, that's a great challenge. The struggle never ends. There are people who are trying to make profit out of things that are not good for our kids. The struggle never ends. You've accomplished a lot, but it's just the first step. You've got to keep on struggling. You've got to educate the school board or whoever's in charge of regulating what's right outside. You've got to bring all this information and just go on to the next target. Struggle never ends. Keep on fighting.
Other questions? All right, let's give them another big round of applause, please.